Good evening, ladies and gentlemen. This evening we are going to be talking about hypertension, which is otherwise known as high blood pressure. So as per usual, I'm just going to do a really quick overview of what hypertension is. We're going to talk about some of the contributing factors that may make you susceptible to it, or also sustain it if you do have high blood pressure. And then we'll look at some dietary, some lifestyle, and some supplemental interventions that you can take to help kind of keep it under control. Okay, so firstly, what is blood pressure? All right, so we've got the heart, which is constantly pumping blood around the body and through the blood vessels. So our blood pressure is the amount of force that is being exerted on the walls of the arteries by the blood as it's being pumped. So somebody who has high blood pressure or hypertension, it means that the blood is pumping through the arteries with more force than normal. Now, when we measure blood pressure, we speak about a diastolic and a systolic figure. You may have heard these two terms before. So your diastolic pressure is the pressure in the arteries when the heart's at rest between its beats. Now, this is the figure that appears on the bottom of a blood pressure reading. Then you have the systolic reading, and this is the pressure in the blood vessels when the heart is beating, and this is the figure that appears on the top. So ideally, a blood pressure reading that is healthy and good is around about 120/80 millimeters of mercury. So when we look at blood pressure classification, this is just a table that shows the different classifications for you. So your second column looks at your systolic reading and your third column looks at your diastolic reading. As I said, if we look at that first column, we've got a normal reading, which is systolic less than 120 and diastolic less than 80. Your second column is pre-hypertension, and that means that it's, I guess, what you'd call high normal, and that is just on the verge of being a stage 1 hypertensive patient. Pre-hypertension is 120 to 139 for your systolic reading, and between 80 and 89 for your diastolic reading. Then you move on to stage 1 and stage 2, and as you can see there, the figures do increase for both of those. Some tables you might also find have a stage 3 hypertension, and that is when it's above 180, so that's very high and also very dangerous. Still looking at our classifications, the different classes that you can come under when you do have hypertension. The first one is essential hypertension, and essential hypertension is when a direct cause for the hypertension cannot be established. Now, this is usually 90 to 95% of hypertension cases, and many have identifiable behaviours that contribute to this condition, and we'll talk about a few of them in just a minute. Next, we have secondary hypertension, and this is the remaining 5 to 10% of patients, and this is due to an identifiable cause. Once again, we will talk about that shortly, but in contrast to the essential hypertension, where they don't know what it is that's going on, in secondary hypertension, there's quite a clear and identifiable cause for it. Then we have white coat hypertension. Now, this is when you have elevated blood pressure in an office or a clinical setting. It's a bit of a phenomenon that goes on, and the people that actually have white coat hypertension are more at risk of developing hypertension later on in life. So for these people, and if you are one of these people who finds that your blood pressure does go up when you're at a doctor's office or you're getting your blood pressure taken, a good thing to do is have your blood pressure taken, then sit there and relax for 5 to 10 minutes just to get your emotions, etc., under control. Have a chat to your doctor about a few other things, and then the blood pressure reading can be taken again. And usually the second time it comes back down to a normal level when you've had time to calm down. When you are having your blood pressure taken, it's you can never just go off one reading, okay? So you need to have your blood pressure taken a few times over a space of time so that you can get an accurate measurement of what your normal blood pressure is. If you are having your blood pressure taken at home, if you've got a machine, which a lot of people do, it's important that you're always measuring your blood pressure on the same machine. Otherwise, your results are going to be quite skewed. And a lot of those machines, while they're good to have at home, some of them are not entirely accurate. So if you are relying on a home machine for your blood pressure, it's also a good idea to take it into a chemist or your doctor and get them to measure your blood pressure as well. And you can compare the two readings to see how off your reading could be for the one that you're using at home. So some of the contributing factors that can cause hypertension. So firstly, we've got genetics, and the rate for hypertension is actually greater within family groups than in unrelated individuals, just saying that there is a strong family history, that if someone in your family has hypertension, then the chances of you having hypertension are a lot higher. Ethnicity. So it is more common in certain ethnic groups. One group that seems to have a very high prevalence to hypertension is African Americans. Now, that's not to say that they're the only people that are going to develop hypertension. They are just one of the groups who have a much higher rate. Socioeconomic status. So individuals that come from lower socioeconomic backgrounds and those that have poor access to education are at an increased risk of developing hypertension. Now, that can be due to a lack of education. If they don't know what hypertension is and they don't know what can cause it, then obviously they're not going to be making lifestyle and dietary choices to avoid that. Also, lower socioeconomic status means that you don't actually probably have the same income as a middle or an upper class family. So the foods that you're going to be buying are probably going to be of a poorer quality as well and not as nutrient rich. Age. So blood pressure naturally rises with age, and with that the incidence of hypertension and cardiovascular disease does increase. Sex. So young to early middle-aged women have a much lower prevalence of hypertension than males in the same age group, and that is possibly due to the protective effects of estrogen. Obesity. Obviously, individuals who are overweight are going to carry a much greater risk of developing hypertension. Diet. So this is one of the most important determinants of essential hypertension. So you've got your nutrient poor diets that are low in fresh produce and high in saturated fats are going to be both predisposing and sustaining for high blood pressure, meaning that they're going to make you susceptible to it in the first place. And then once you do have it, they're going to make sure that you still have it and you don't actually lower your blood pressure because you're continuing these eating habits. It's actually been shown that vegetarian diets have been shown to significantly reduce blood pressure in hypertensive patients. So it's something to keep in mind. If going vegetarian is too much of a stretch for you, then just to consider having a few vegetarian days of eating during your week to really help level out those blood pressure levels. Stress, just as we've discussed in the white coat hypertension, stress can cause blood pressure elevations. And smoking. So smoking has independently been associated with hypertension, and it also increases your arterial stiffness, which can lead to hypertension. So arterial stiffness is not what we want. We want those arteries to remain quite elastic and flexible. Okay, some of the complications now of hypertension. So cardiovascular disease. So hypertensive patients have a much higher risk of developing cardiovascular disease compared with those that don't have hypertension. And this rate rises significantly for those people that don't actually do anything to treat their hypertension. So if they just let it go and run its course, then they're at a much greater risk of developing cardiovascular disease. Ischemic heart disease is the most common form of organ damage that's associated with hypertension, so it can be really serious and something that you don't want to let go. You need to speak to a professional about managing it so that you're not causing yourself some serious injury. Diabetes, this is very common in hypertensive patients. Hypertension is very common in people that have diabetes, and 70% of people who have type 2 diabetes report having elevated blood pressure. It can be very difficult to control when it's diabetic hypertension, and your blood sugar levels often fluctuate dramatically when this is occurring as well. Renal disease. Chronic renal disease commonly presents with hypertension, and treatment's usually aimed at slowing the deterioration of your kidney function, as well as preventing further deterioration of cardiovascular symptoms. And also pregnancy. So hypertension is one of the most common medical complications of pregnancy. It's associated with preeclampsia, which is a serious condition that the mother experiences sometimes in pregnancy, and it can have some serious consequences for the baby. So once again, really important to keep that under control. So if we're looking at some dietary interventions now, what can we do diet-wise to stop hypertension, to prevent it from happening in the first place, or just to reduce its occurrence once we do have it? So the first thing is to reduce your dietary sources of sodium. So most Western diets contain an excess of sodium, with the majority coming from processed foods. Now, the NHMRC, which is the National Health and Medical Research Centre, recommends no more than 4 grams a day of salt, and that's roughly equivalent to about 1,600 milligrams of sodium. And for those that have hypertension, your intake should be below 2.4 grams a day to improve your blood pressure readings. So some of the things you can do to reduce your sodium intake: you can avoid adding salt to your cooking. Do not add salt at the table. A lot of people just have a habit of the meal arrives in front of them and they add salt to their meal straight away without even tasting it. So I know a lot of people that get quite annoyed by that, but just try and taste the food before you add salt to it to see if it's actually required. Bread is actually a major source of sodium, so your choice is either cut bread out altogether, or you can just choose bread that is low in salt. Reduce your processed food consumption. So processed food contains a high amount of sodium, and that really boosts your sodium intake for the day. Reduce takeaway foods. Once again, they contain a lot of sodium. Fresh fruit and vegetables instead of canned. When food goes into a can, sodium goes into the can as well. You can buy low salt or salt-free foods. And use herbs and spices to flavour your meals instead of adding salts, as well as making your food taste great. There are so many different flavours that you can use with your herbs and spices. They also have a range of protective health benefits as well that you're going to, just get an extra advantage by using them instead of your salt. Salt content in foods. So this is just a quick table that shows how much processing actually increases the sodium content. So if we just look at the first column, you've got plain pasta, which has got 5 milligrams of sodium in it. You look over next to it, packaged pasta with sauce, 800 milligrams of sodium, which is a massive, massive jump from the 5 milligrams from the beginning. If you look at your fresh salmon there, which is a couple down, 56 milligrams of sodium. Once it's canned salmon, 457. So it is just such a massive jump with the amount of sodium, and you can see how that sodium quickly adds up in your diet daily. One more quick table. So this is the Salty 6. So just popular foods that really boost, once again, your sodium levels. So we've got breads and rolls, cold cuts and cured meats, pizza, poultry, canned soup, and sandwiches. So all these really do contribute quite dramatically to your sodium intake for the day. So dietary interventions, we can also reduce our saturated fat intake. So diets that are high in saturated fat are actually linked to an increased risk of cardiovascular mortality, and they may impact hypertension by altering your blood viscosity. So you'd want to replace that with your omega-3 fatty acids, which have been shown to have positive effects for cardiovascular health. Lower our caffeine consumption. So high consumption has been shown to have a hypertensive effect, and this is because it actually increases the peripheral vascular resistance. Remember, you need to consider all of your sources of caffeine. So it's not just coffee, but it's tea, including green tea, your energy drinks, your soft drinks, and also dark chocolate. Reduce your alcohol consumption. So reduce or avoid, because alcohol can have serious implications when blood pressure is involved. And finally, the DASH diet. So this stands for Dietary Approaches to Stop Hypertension. And it's basically a diet-based approach without the use of medication to lower your blood pressure. It's rich in fruit and vegetables. It's low in fat or it uses low fat or non-fat dairy. It also includes mostly whole grains, lean meats, fish and poultry, nuts and beans. It's high in fiber and low to moderate in fat. And people that follow the DASH diet have found really, really positive results in being able to get their blood pressure under control. If we're looking at nutritional interventions, B vitamins, particularly B6, B9 and B12. So supplementation with B vitamins is a way to reduce your homocysteine levels, and it also may be a way to lower your cardiovascular disease risk. So increased plasma homocysteine is an important risk factor for cardiovascular disease, so being able to keep these under control is a really important thing to do. Magnesium. This regulates healthy blood pressure by regulating the transport of calcium, sodium, and potassium. So a deficiency of magnesium is linked to hypertension. Your essential fatty acids, as we've already spoken about, these have a protective effect for coronary heart disease. It can be due to the anti-inflammatory effects of the essential fatty acids, and also the ability to alter the hormones that are responsible for getting the blood vessels to contract. Antioxidant nutrients are next, particularly vitamins C and E. So oxidative stress is strongly linked to hypertension, and both vitamin C and E can help to reduce your blood pressure due to their antioxidant activity, and also because they are able to downregulate reactive oxygen species. And finally, coenzyme Q10. So CoQ10 is able to lower your blood viscosity, which is the thickness of your blood. It improves the diastolic function. It scavenges free radicals. And it's an antioxidant, so it's doing similar things to the vitamin C and E. In one study, CoQ10 was looked at, and 39% of hypertensive patients were actually deficient in coenzyme Q10. So one of those really important cardiac enzymes that we spoke about earlier. And finally, taurine and arginine. So these are both amino acids that have been shown to reduce your blood pressure. Found in a whole lot of foods, foods that are rich in protein, so your meats and your vegetable proteins as well. If you're including them in your diet, you're going to be making sure you get taurine and arginine. But supplementation, if you think you're low, can have some beneficial results for your blood pressure. And now lifestyle interventions. So weight management. Obviously, this is going to be preventive against hypertension. If you can stay in the healthy weight range, you're going to reduce your risk of developing high blood pressure. And if you lose weight when you already have hypertension, then you're going to lower your blood pressure. Stress management. So increased stress is linked to a rise in blood pressure. And on a regular basis, this can become very problematic for your blood vessels. So stress reduction techniques such as meditation, yoga, massage, getting out in nature and walking are all going to be really effective techniques and really simple to do. Exercise. So regular exercise is recommended for hypertensive patients. It's best to start small and work up to more advanced exercises. Around about 30 minutes per day, most days of the week, is a really good guide to work off. But contraindications or reasons for not exercising can include if you have unstable angina, uncontrolled or very severe hypertension, or if you have an acute infection or fever, you shouldn't be exercising. When you are exercising, if you're feeling unwell, if you're lightheaded, if you have dizziness, nausea, etc., you should stop exercising right away and speak to your doctor about it. And finally, smoking. As we've already mentioned, smoking can increase your arterial stiffness and lead to hypertension. It also has a whole range of other detrimental effects on the body, which I'm sure you're all aware of. So it's just best to avoid smoking altogether. So just to summarise what we've gone over tonight, while there are some contributing factors that are out of your control, there are still a number of interventions you can employ to reduce your risk of hypertension. Diet has a significant impact on the development of hypertension, particularly the amount of salt that's included in your diet. So ensure that you're aware of the salt content in the foods that you're buying, and also the amount of salt that's being added to home-cooked foods. So learning how to read labels is really important, and just being aware of the salt content in your food and what is being added at home can have a dramatic effect on it as well. Finally, supplements can assist in the prevention and management of hypertension, but they should never be self-prescribed. I know I do harp on about this, but it's a really important one because it can be very dangerous if you decide to just start taking supplements without really knowing what you're doing. If you are interested in going down the supplement route, then seek the assistance of a healthcare professional, just so that you know that the advice that you're going to be receiving has been backed up by case studies and scientific evidence, and you know that you're going to be covered. So that brings us to the end of our hypertension information session. So I hope that you've been enlightened and you found it informative. Nick is now going to give his presentation, so we'll just get that set up, and we'll be with you very shortly. Thanks very much, and I'll see you again next time.
Okay, thanks very much for that. That was a really good presentation about hypertension and how good nutrition and special nutrients can actually help with managing that condition. Apologies for starting with our nutrition presentation tonight. Usually we go the other way around and we present our hair regrowth topic, but we've just spun that around tonight. We'll be a couple more minutes and then we'll get going with the hair regrowth topic. Thanks for your patience. Okay, welcome back. Sorry for the delay. Okay, now on with our hair regrowth topic this evening. This is our usual monthly presentation that we do. Just thanks again to our nutritional consultant that's come in and presented first this evening. Apologies again for that. We just moved that around tonight. Yeah, we'll get started on our topic tonight. And then just keep in mind, after this presentation, we will have our November lucky draw. It's a yearly lucky draw that we do, and we will announce the winners for both our Oz Hair and 101 customer base. So stick around for that lucky draw after this presentation. So tonight our topic, why standard hair loss treatments fail. If you've watched some of our other presentations in the past, you'll notice that we've often spoken about other treatments, particularly pharmaceutical treatments. So you've probably got a little bit of an idea about what we'll cover tonight, but we'll try and add in some slightly different things. What we'll do tonight is we'll firstly discuss what standard hair loss treatments are available, and then we'll go through the reasons why these treatments will fail, or probably the better word is are limited. And finally, we'll just have a very quick overview about how our treatment actually regrows your hair. So let's look at these standard hair regrowth treatments, which are basically the common pharmaceutical treatments that are on the market. And they are the two major treatments, minoxidil and finasteride. Minoxidil is that it's the externally applied lotion. You apply it externally to the scalp, and finasteride is the one that's taken orally, usually as a tablet. Minoxidil is it's easily purchased over the counter at your local pharmacy in either a 2% or 5% form, and 7% is also available. However, that's usually you need to go to your family physician for a prescription for that one. And with finasteride, that medication must be prescribed by doctors. It's not an over-the-counter medication that you can get from your local pharmacy. It must be prescribed by your physician, and the dosage on that one is usually 1 milligram per day, is the recommended dosage. So just a little bit of background on minoxidil. It was originally used for high blood pressure and even a anti-ulcer medication developed many years ago. And I guess with using that drug for a period of time, people noticed that they were growing more hair. So as a side effect, probably a positive side effect, was that people that might have had blood pressure problems were actually able to regrow some hair. So that's a little bit of background on that drug. So minoxidil, not specifically designed or created for hair loss treatment. It was originally used for another condition, high blood pressure in this case, and it was just as an extra effect of this treatment. It was found that it was also useful for growing hair. Finasteride, that's the medication usually prescribed as a tablet in tablet form, was originally developed for benign prostatic hypertrophy, which is basically enlargement of the prostate gland in males. Again, this drug was not specifically created for the treatment of hair loss. It was originally used for prostate problems in males. A little bit more information about minoxidil. It is it's a vasodilator, which means it opens up the blood vessels, and that's why when applied locally on the scalp, it actually acts as a blood vessel opener. It increases the blood flow to the scalp, so you're going to get more blood supply to the hair follicles, and usually there's lots of oxygen and nutrients in the blood. So theoretically, you should get some improvement in your hair condition, and also some hair regrowth, because you're getting more blood going to the roots of the hair. Finasteride, on the other hand, it works by inhibiting DHT, which is the hormone that's largely responsible for hair loss in cases of genetic thinning or androgenetic alopecia. And the way this drug acts is by binding to one particular enzyme that sits around the base of the hair follicle, and by binding to that, it actually will slow down the amount of DHT that's being produced, and therefore reducing miniaturization. And we'll go in and talk a little bit about how that works with some nice diagrams now. So we've got just over here testosterone that's roaming around in your bloodstream. When it gets to the when it arrives at the blood vessels in the scalp, testosterone combines with just here the 5-AR enzyme. Enzyme is basically a substance. It's a protein that basically helps to sort of speed up biochemical reactions in the body. And when that happens, we get the production of DHT. Dihydrotestosterone is the name, is the longer word for DHT. So basically, what happens is that when this DHT builds up at the hair follicle here, it can actually create a small immune reaction or a bit of inflammation there, which creates fluid buildup, and that can actually lead to some obstruction to the blood supply, feeding the roots of the hair. So what actually happens is, as I've just mentioned, your DHT binds to receptors at the base of the hair follicle just here, and this obstructs the blood supply to the follicle. So you've got less oxygen, vitamins, minerals, and proteins feeding the hair. Remember, these are the substances that are in the blood, or some of the substances that are in the blood that are very useful for the health of your hair and regrowing hair as well. So when you get this obstruction of blood flow, this cutting off of essential nutrients to the hair follicles, you end up starting a process called miniaturization, which is basically shrinking of the it causes shrinkage of the hair follicle because there's less nutrition there. So over time, your follicles are getting thinner and thinner. So these are your normal follicles. You can see over time it's losing color, it's getting thinner as the hair's coming out of the scalp there, until eventually it's not just, you're not just getting thin hairs, you're getting hairs the hairs are just not coming up anymore. So which results in baldness over time. So just going back to our original question of the topic, why standard treatments fail. Well, there's two major reasons that I'll discuss this evening, and the first is side effects, and another one is also the effectiveness of these standard treatments, these standard pharmaceutical treatments. So firstly, with regard to side effects, let's have a look at the drug minoxidil. Some of the common side effects with that are blurred vision, chest pain, dizziness, irregular heartbeat, swelling of the face, and rapid weight gain. So some side effects there that are not obviously very pleasant. And now moving on to finasteride, we've got the major symptom that's described here is sexual dysfunction. And, we've got some different sources here. We've got the Swedish Medical Products Agency. We've got the MHRA in the UK, which is talking about sexual dysfunction and erectile dysfunction when with use of finasteride as a potential side effect. Not everybody gets it, but it's definitely in the literature as a side effect in a percentage of male users. So something definitely to be concerned about if you're a male thinking about taking up this type of treatment. And keep in mind, with females, finasteride can actually cause birth defects, so definitely not birth defects in pregnant women, so definitely not recommended for pregnant women. And The other side effects of finasteride, I've got a list here: chills and cold sweats, mental confusion, dizziness, weight gain or weight loss, tingling of the hands and feet, facial swelling, swelling of the arms, legs and feet, and skin rash as well. What I'll do now is I'll go in and present a couple of cases of, these are real cases of people that have actually come in and seen us for their hair loss, and obviously looking for a different type of treatment. They tried the standard hair loss treatments before and had some problems with those, and I'll go through and discuss what actually happened in their cases. So we've got one young gentleman by the name of Sean in his late 20s with androgenetic alopecia. So that's just basically the standard genetic thinning, the standard male pattern type thinning, who used minoxidil and finasteride for 2 years. After 12 months of use, he noticed reduced sex drive, a decrease in his energy levels, and also depression. And those probably mainly attributed to his use of finasteride. Obviously, I think an interesting point here is that his side effects didn't actually start until over a year later, and I think he's continued the treatment for 2 years. But during that second year, he's actually these side effects have actually steadily become worse. So he's gone back to his medical doctor, and they've actually advised him to stop taking the medication. So, look, he was just one of the guys that couldn't handle this medication long term, and I guess at that stage he was, he'd spent a fair bit of money on the pharmaceutical treatments for his, to try and regrow his hair, and did get some results. He did find that the pharmaceutical treatment did help him, but after a year or so on the medication, due to the side effects, he actually had to stop taking it. So he was in a position at that time where he gotten a good result, spent quite a bit of money, but then had to stop taking the medication. So I guess he might have been worried about that he'd wasted his money and probably not sure what to do next. So that's another issue you've got with, or some people may have with the standard hair loss treatments, is that they might give you some results, but in time, if you suffer from side effects, you will have to stop taking the treatment, and potentially after stopping for a period of time, you'll lose more hair because you've stopped the treatment. Keep in mind with hair regrowth, most treatments, when you find that they're effective, you need to continue using them. So it can put people in a difficult position if side effects come much later into the treatment, because as I mentioned, you've already spent money on the program. You might be happy with the results, it's working for you, but then you have to stop, and then you might not be sure what to do. So because of side effects, so even though you've got the result, but you're getting side effects, that's obviously an issue. So anyway, in this gentleman's case, he obviously started looking for a safer alternative. He found us and went on to a 2-month program. These are his results. I hope that's reasonably clear for you at home, but basically I can see some definite difference between the before and after photo. This magnified image shows a little bit better, some darker hairs coming up, and generally more hair in the after magnified photo. And this further close-up photo is showing hair roots that are actually thicker. Just in a couple of months of treatment, pretty good result. He didn't lose any more hair in this period of time, as he was sort of coming off the other medication he was taking, and that is often a problem with people that are taking the pharmaceuticals for hair loss, is that when they come to us and they stop taking the pharmaceuticals, there's often a sort of like a rebound effect. You stop taking it, and then the hair loss can actually come out quite severely as soon as you stop taking it, because your body's obviously adjusted to always having that medication either applied or ingested. So that's an interesting case with this gentleman that did experience some side effects, particularly with finasteride use. Another case I'd like to discuss is an older gentleman in his 50s, also suffering with genetic hair loss or male pattern hair loss. He used minoxidil as an externally applied lotion for just a week. And within 6 to 7 days, noticed he was having some issues with the skin on his fingers. Apparently, it started peeling off, and he became very concerned. I mean, I guess he was worried about if it was peeling on his fingers, what was going on, on the other place where he was applying it, which was his scalp. So, obviously, being concerned about this, he stopped using the lotion and started some treatment with us. Using our all-natural herbal treatment. And within a couple of months, we got some pretty good results. His crown, if you can see here, just at this point A here, quite thin in the before photo. And then if you come down here to the after photo, sorry, just there, you can see how that that crown is looking a lot fuller than it did 2 months before. So, what's that? July, August, September. Yeah, a couple of 2 to 3 months. 2 to 3 months after. So, quite a good result, and probably not a lot of hair regrowth in a 2 to 3 month period. But a lot of the existing hair is actually in a lot better condition than it was prior to treatment, and those better conditioned hairs are now standing up, standing more erect on the scalp, and that's giving the appearance of a much thicker, much thicker hair in the area, which is fine. I mean, we didn't regrow a lot of hair in that period, but if the existing hair's standing up a lot more, geez, that area looks a lot thicker than it did before. So that's a very good result in our book. There's a side view there. There's the previous situation there. And as you can see, that area is just completely filled up. Point A dash there is it's really basically covered it all up. So yeah, very good result there after just a couple of months. Let's go on and talk a little bit more about effectiveness, or the issue with effectiveness, I should say, with standard hair loss treatments. So So let's talk about the effectiveness of, we've mentioned minoxidil and finasteride. Let's look at their effectiveness as shown by their own company's clinical study. And this particular one was completed in 2004, over a year, and they found 60% effectiveness. Okay, so that'll be that's 60% effectiveness over 1 year. So that could be some people that had regrown some hair while on the treatment, or at least prevented any hair loss, still considered an effective result. That's for minoxidil. In 1999, the study on finasteride found a 48% effectiveness after 1 year. So they're the figures there. Again, completed by the actual the company itself. And we'll look at a study that we did a number of years ago, where we've achieved, as you can see here, 99% effectiveness. Now, that's not everybody that grew a huge amount of hair. We've got a percentage of people here at 3.1% that grew quite a considerable amount of hair. We've got some moderate regrowth here as well, and some more marginal regrowth as well, followed by some people that were unchanged. So what we mean by unchanged is that the level of hair loss didn't actually worsen over the 12 months, which is still a good result. It still means that the treatment was able to, particularly over that long period of time, able to maintain the person's hair at their current level. So still a positive result. So yeah, just a couple of other side issues I'd like to discuss very briefly about, just regarding the effectiveness of standard hair loss treatments, is that with the pharmaceutical treatments, they don't really advocate any sort of deep scalp cleansing, which we do here at our company, here at OzHair. And the reason why I've listed that as a potential issue is that a couple of reasons is that if you've got a very oily scalp with a lot of particularly the dry oil, the dry sebum build up in the scalp, blocking the pores, that might actually affect some of the new hairs that are trying to come up, just as part of your normal hair regrowth cycle. So that's one issue. If your pores are blocked with oil and dirt, it can actually affect some of the new hairs come up. So you might not be thinning as badly as you think, but the pores are blocked. So the hair's trying to come up, but it just can't actually get through out of the pore because it's actually blocked with oil and dirt. So from our point of view, scalp cleansing is very important from that sort of perspective. Another issue is that look, I take an educated guess and say that if your scalp pores, if a number of them are quite blocked, and you're using either a pharmaceutical hair regrowth preparation or what we sort of advocate, which is a herbal treatment, regardless of which one you decide to use, if the pores are blocked and not as very very congested, then whether you're using a pharmaceutical or a herbal treatment, those treatments are probably not going to get absorbed as well because the pores are blocked, and all of these, either drug or the herbal active ingredients, they need to be absorbed by the scalp. So if the scalp's dirty and oily, it's not going to absorb those medications as efficiently. Okay, so that's something that we believe here is very important as part of our treatment process to at least better absorb the herbal ingredients, those herbal actives that we provide people as part of their treatment. Another issue I'll just touch on is that with standard hair loss treatments, there's not a lot of focus on good nutrition for hair follicles, whereas with the Oz hair treatments, we've got some very essential nutrients within the external liquids that we apply to the scalp, as well as the herbal tablets that people take orally or internally as well. So we're big on nutrition, nourishing the hair follicles internally and externally. So we believe that's very important, that the follicles have the correct nutrition that they need. They're sort of the basic building blocks to to help maintain healthy hair and also regrow new hair. Without the optimal nutrition, it's a lot harder to have healthy hair and in particularly regrow hair. So we'll go through and quickly discuss a case of this case is related in particular to the effectiveness of the standard hair loss treatment. So we're still on the topic of effectiveness. So this young gentleman was suffering from a condition called alopecia areata, which is a little bit different to the genetic thinning type of hair loss. This is actually an autoimmune disease, which means the body's defense system is attacking its own tissues. So what happens in alopecia areata cases is the body's immune cells actually attack the hair follicles and temporarily sort of shut them down. So this gentleman here actually had that condition and was using steroid-based drugs applied topically and I think internally as well. And the result of this was not so much in the way of side effects, but more that he didn't actually get any benefit from the treatment. So no hair regrowth results, and obviously stopped using the drug as a result and tried one of our treatment programs and had some pretty good results. There he is here in the before shot. There, quite a lot of thinning going on there, a lot of patchy hair loss. That's one of the characteristic features of alopecia areata. It's the patchy baldness that you get. And as you can see down here, he's still got a bit of a patch here, but much better in some of those, this area here and sort of down the bottom where it was a lot more patchy and a lot thinner. So very good result there. This is on the sort of top of the scalp. If we go to the back, sort of showing the top of the crown area, very thin here at the top, lots of patches all around, and down here a lot, still some patches, but the size of the patches are markedly reduced after what is it, about 3 months, 2 to 3 months of treatment. I think our premises were being renovated at the time, so he might have lost a month of clinical treatment, but still pushed on with the home-based treatment and was still able to get that very good result. So, yeah, we've shown a few cases relevant to adverse reactions of the standard hair loss treatments, and also the effectiveness of standard hair loss treatments. I'll just go through and just quickly zip through our method of treatment here at OzHair. We use a treatment protocol called herbal follicular activation. It's a fancy name for a treatment system that basically stops excessive hair loss in initial stages. It cleanses and unblocks scalp pores, which I mentioned before is very important. Activates and nourishes hair follicles, and also reduces hair follicle sensitivity to DHT, which is that hormone we mentioned before. It involves, this treatment protocol involves a combination of both home use and in-clinic treatments. And as you've seen in some of the results we've given, I've provided earlier, we do get some very good results in a relatively short period of time. I mean, I showed you some results over sort of the 2 to 3 month period, but we've got other people that have sort of taken 4 to 6 months before receiving the same level of improvement as those people you've seen. It really depends on people's body and how they react to the treatment. That's one factor. And also another factor is their level of hair loss. Obviously, the more advanced stage of hair loss that they're at, it's going to take longer to get a improvement. So yeah, didn't want to go into too much detail with our treatment, but I will refer you to our website for more details. Here we are at www.ozhair.com.au. It's a lovely website with a lot of good information about our treatment protocol and herbal follicular activation. Lots of testimonials, really nice video there about sort of what we do and how we're different to the standard hair loss treatments. And a few more testimonials on that video as well. So definitely go there and check that out when you have time. Yeah, so just in conclusion, I'd like to just finish by just reiterating with the standard hair loss treatments, there are some problems with side effects. As I mentioned earlier, not everybody will suffer from these side effects, but I guess we tend to get a lot of those people that have gone down the pharmaceutical treatment road and had problems. So we just feel it's fair to warn people about potential adverse reactions to these treatments, and at least people can at least that way people can make an informed decision. Even if you decide you want to go pharmaceutical, that's fine. We're not against that, but at least you're making a more informed decision. You know the potential risks, and if you're still happy to go ahead, then that's certainly okay. At least you were informed. We feel that's fair that you at least should know about that. And another point is the limited effectiveness. As we mentioned, 48% with finasteride. I think it was 60-odd% with minoxidil, and our OzHair treatments do offer a viable alternative. With a very good success rate that we have, 99%. So we believe we do offer a very as I mentioned here, a good viable alternative for hair regrowth without the need to worry about side effects, which obviously has been an issue with the standard, and still is an issue with standard hair loss treatments. So that's all for this evening. I hope you've got something out of our talk tonight. Again, apologies for having the nutrition topic presented first. But look, we believe these nutrition topics are also very important. We think, we know a lot of people out there, do suffer with common conditions such as high blood pressure. So we really want to, we're very big on education here, and if we can give people a bit more information about, other other areas in healthcare, we're more than happy to do that. So we'd like to continue that in the future with our nutritional topics. And you can obviously, if you're suffering from hypertension, high blood pressure, or I think diabetes was our last month's topic, we hope you get some benefit out of the information provided. Feel free to share that with your friends and family as well, because it's great information that can help a lot of people. So we hope you got something out of that this evening. Thanks again for your time. We will be back very, very shortly with our lucky draw presentation. Bear with us for a couple of minutes. We'll get that sorted out, and we'll get that done, and we'll announce the winner or the winners. Thanks for your patience. Stand by. Okay, welcome back. We'll do our lucky draw. We'll draw our lucky draw prize now. And I know you've all been waiting for this. Thanks for your patience. We had to postpone this date a few times, but we'll do our Oz Hair lucky draw. We'll actually have two lucky draws tonight. We'll have one for Oz Hair, our Oz Hair customers, one also for 101 customers. So I'll draw the first one. First will be the second prize for Oz Hair, which is one heat pack recharger with 3 small heat packs. Okay, so we'll see who the winner of that is first. I'll just go in and the winner there. Okay, and it is to Miss Serene L. I would say the family name, and she's our second prize winner. Congratulations, Serene. You're the second prize winner of the Oz Hair lucky draw. So that's on there done, and we'll contact. We've got your details there, Serene. So we'll contact you and make sure that you get that prize. And now we'll do the first prize now for our Oz Hair lucky draw. Let's move around a little bit. And got that one there. Okay, it's Mr. Sheng W. This is for our first prize. Congratulations, Sheng. You're the winner. You're our first prize winner of our Oz Hair Lucky Draw. You've just won a free complete 2-month treatment program at an Oz Hair Clinic at Chatston. So that'll be some home use products and also some clinical treatments for you. So congratulations on that. And that's the end of there are winners for Oz Hair. And now for one moment. Okay, back again. Apologies for that. Okay, so we've also got some other entrants as well, and they will receive. They will also receive our second prize of 1 heat pack recharger with 3 small heat packs as well. We'll also make contact with you guys for that. Thanks so much for your entry in our Oz Hair Lucky Draw. Now we'll go to our 101 Lucky Draw. And again, we'll just closing my eyes, and we'll draw the second prize now for 101, and it is okay. That's Greg W. Greg W. Greg, we've got your contact details here. Congratulations, you've just won our second prize of our 101 Lucky Draw. Also a heat pack recharger with 3 small heat packs. Congratulations, Greg. We'll get that out to you shortly. And now for our first prize, which is a free 101 Regrowth 4-month starter pack. Okay, and we'll draw that one now. Mixing around, and the winner is Marissa R with a family name R. Congratulations, Marissa. You are the winner of our 101 Lucky Draw, first prize winner, and we've got your contact details. We will we'll contact you shortly to receive that first prize. Okay, and all our other entrants as well. Keep in mind, the other entrants here will also receive a prize. We'll send you out a small heat pack as well. Thanks so much for entering our lucky draws. And if we have one in future, we hope you join us again, and we hope you can win some more prizes. Thanks for watching. We'll see you next month.